mind, body, and spirit. This podcast is dedicated to individuals who are on a quest to uncover their truth, understanding their genetic and spiritual DNA, and learning how to harness this knowledge to achieve optimal health. But this isn't just another health podcast. Natural Health Podcast is here to ignite a spark of hope within you, reminding you of your inner potential for greatness. You are pure love, capable of living life to your fullest expression. Are you ready to embark on a transformational journey to achieve optimal health? Today on the Natural Health Podcast, we're joined by one of the most respected voices in modern allergy and immune system care. A doctor who spent 25 years bridging the worlds of conventional science and holistic integrative medicine. Dr. Dean Mitchell is a board-certified allergist, immunologist, and integrative medicine specialist, and the founder of Mitchell Medical Group in New York City. He's a pioneer in sublingual immunotherapy, a safer, more natural and non-invasive treatment for allergies that has helped thousands of people transform their health from inside out. He's also the author of Dr. Dean Mitchell Allergy and Asthma Solution, a groundbreaking book that empowers people to reverse their symptoms one drop at a time by treating the root cause of their allergies and not just masking it. Dr. Mitchell is a NYU School of Medicine graduate, a national recognized educator, and the host of the Smart Medicine podcast, where he explores the future of health, longevity, and chronic illness treatment. Today, we're diving deep into allergies, immune system intelligence, environmental triggers, the rise of food sensitivities, and why modern life is making us more reactive than ever. Plus what you can actually do to heal. Welcome to the Natural Health Podcast, Dr. Dean Mitchell. I'm so excited to have you here today, and we're going to be talking about all things allergies. But before we get into there, we just had a little bit of a talk about tennis. Tell us a little bit about your biggest hobby, tennis. Do you still play tennis? Did you play tennis?
Yeah, oh gosh, if you got to start talking about tennis, we may never get to the natural health stuff, but I've been playing since I was a teenager. Got really hooked on the sport. I actually was very in awe. I looked up to the Aussies, the Rod Lavers, Ken Rosewalls. They were just so consummate professionals, and I just dreamed of being like them. And I ended up playing in high school, a little bit in college. Then private practice and medicine took hold, and I got a lot less time to practice and play. But I've been back at it again now, and I'm loving it again more than ever.
Yeah, amazing. And I don't know if you've seen the latest research about racket sports.
No, what they
Yeah, so
say?
the latest research about racket sports is that they're the highest longevity sports. So compared to like soccer, football,
Well,
athletics,
you're less
anything like
likely to
that.
get an injury in tennis. Like that was one of the great things about tennis during COVID. You're not right next to somebody, so
Yeah, 100%. And it's that coordination with having not
yes,
using your
yes, it
hands but using
is.
the racket. So
It's funny when listening to Mikhail. Ever since I was a kid, it's really funny. My house was, like 200 yards from the tennis courts where my high school was, and I just loved the sound of that ball pinging against the racket. I've never gotten over that. That's why I'm not a pickleball guy or anything else. I'm pure tennis.
yeah, I was actually gonna ask you the question. Are you into pickleball? Have you
No,
tried it?
I'm anti pickleball.
Anti pickleball.
Well, they're
I
taking up all the tennis courts. I mean, they've invaded the United States. I don't know about Australia.
I do play pickleball here and
Yeah, I
there.
know
I
people
do.
love it. My sons love it.
It's good because it's just like it's a short game. It's in and
Yeah, it seems
out.
very social and fun.
Yeah, yeah. Whereas it's social and fun. Whereas the tennis is a bit more
Tennis is
strategic,
serious. I go
right?
out there, I go to kill.
I love it. I love it. Well, hopefully one day you can make your way down to the Oz
I
Open
hope
here.
so. I hope someday I do.
Yeah, amazing, amazing. So, you played tennis, and then how did you make your way to medicine? Like, what happened? Were you just always interested in it? Was it something
Yeah, well,
that,
I was telling somebody else to be asking on that almost that similar question on another podcast, and I said I
yeah,
think I was brainwashed at a young age because my parents they have a photograph when I was 5 or 6 years old. They put a stethoscope around my neck,
they
so
manifested it.
I think I was brainwashed early on. But I did always look up to and admire doctors. Probably the ones you saw on TV, the ones I met in real life, and I think there's some kind of common theme with tennis and medicine about wearing white. So it must be something
Yeah.
I don't know, somehow that kind of intersects.
Yeah, that's a really interesting comparison. So were your parents, were they doctors or were they
No,
in
they were
that
not.
field?
No, they just, my mom was a very bright teacher and My dad was a business person, and I think they always looked up to at that. It was, it was a different time. It's real, medicine's going through a lot of changes, I'm sure, all over the world, but especially in the United States. I mean, I was just reading an article where people have so little confidence in their doctors. It's really sad, and they're really taking. I have no problem, taking information into, digesting it, but when you no longer rely on an expert to help you guide your health, you could run into problems.
Yeah, 100%. It's kind of like I see it as a mechanic, and you try and look after your car,
Yeah,
try to
right. I
change
wouldn't
a
want
few
to. Oh,
things.
trust me, you don't want me fixing your pipes in your house. You'll have a disaster.
I mean, looking at YouTube or using anything to help
Yeah, I
you fix your
mean,
car or anything, it's a bit like, yeah, that might work, but what are you impacting down the line later on?
right. Yeah, no, I tell my patients, I said, with the new tools now, even like ChatGPT, which is amazing. I mean, I use it for a lot of things. It's incredible. But when I'm dealing with a patient, especially some of the complex medical conditions that I'm treating and dealing with, I tell them, I'm glad to have this conversation with an educated person that's informed, but at the end of the day, you're hopefully trusting my experience of treating several thousand patients and knowing how to get you to that good place as soon as possible.
Yeah, no, 100%. So you went to medicine school, and then what got you interested in specifically immunology? Because you could have chosen
Yeah,
so many different pathways, right?
yeah, that's true too. It is interesting. I think when I was interested in going to medicine and all throughout medicine, I was always fascinated with the immune system. And honestly, too, as soon as I finished medical school, I in New York City, I ended up training right in the at the apex of the AIDS epidemic in New York City. And as
Wow,
soon
that
as
would
I
have been
walked on the floor of the
interesting.
hospital, I had 20 AIDS patients I was taking care of, and there was no more a condition that demonstrates that when your immune system is impacted like that, how severe infections happen. But and I did that intensive training for about 5 years. And then when I went into private practice, I really no longer was seeing mainly AIDS patients. I was mostly dealing with allergy and um, a whole range of things. But that experience of really appreciating how important a really good balanced immune system um, never left me.
Yeah, what did you get out of that most out of those 5 years dealing with AIDS?
Mm.
What did you pull out of it?
That it's so important how your own immune system is. In my book, The Conquering Candida, what I published about a month ago, one of the chapters, I forgot which one, I have a quote from Louis Pasteur, the famous French chemist, immunologist, I think Nobel Prize winner. Um, he supposedly said on his deathbed to another Nobel Prize friend, uh, he said, it's not the seed, it's the soil. And that's a very deep concept. And just for the listeners or viewers, I mean, basically what he was saying is that yes, there are different viruses and bacteria that affect people, but the people with the good soil, the people with the strong immune system, they're the ones that usually recover the best. So, because two people could get the same infection and one could be very sick and another one could do quite well. So, I think that's an important thing that never left me.
Love that. So, what is that soil made up that you saw during that time? Like, what is that soil?
Well,
Uh,
unfortunately, that soil, because that virus was so um, aggressive in destroying these patients' T cells, which is such a important part of your immune system, they really had no defense until the medications came along that inhibited the virus from attacking the immune system and the T cells.
mm,
Um, so it was really very different than what I see in practice today, where I'm really working on trying to balance patients' microbiome, the balance of good and bad bacteria in their gut and all over their body.
yeah. So, did you see the people that made it through? They're the ones that had that good gut microbiome, or had it better, like, or was it better mindset, or was it just
Are you
what?
talking about with the AIDS patients? No,
Yeah,
no, that virus was too
powerful. Yeah.
vicious
Okay.
that it really didn't matter too much. It really was a question of having the medications, and that's
Yeah.
why for me also conventional medicine is very important. But I'll tell you something interesting that did affect my career, and I did talk about this in the book.
Yeah.
because I do open up about working on the AIDS epidemic, was that I got exposure to patients with unusual and severe fungal infections, such as candida. These patients would have thrush, white coating on their tongue or in their esophagus, or different kind of fungal rashes. And I was like, whoa, where did they catch that from? But they didn't catch it from anywhere. It was when their own immune system got so depressed, these organisms that we have normally in our body in symbiosis with everything else overgrew and became pathologic. And what I wrote about in this book, The Conquering Candida, and I see in my patients, many patients over 30 years of practice, was that from excessive use of antibiotics, something that people have used commonly and they thought were benign, excessive use of acid blockers, for stomach reflux, um, unfortunately, birth control pills, or even corticosteroids that people use for asthma, even inhaled. These all promoted candida overgrowth in patients, and it resulted not only in stomach conditions, but in skin issues, in chronic fatigue, in brain fog. And that's what the book is really about. Because I think my conventional colleagues, I don't know what it's like in Australia, but my conventional colleagues didn't really believe or understand it. They only associated like candida or thrush or women with vaginitis with like if you had AIDS. But that's not the case. There are many people with, quote, a normal immune system where the microbiome's out of balance and they're getting this candida overgrowth. Sometimes it's visible. For me, that makes it easy. But sometimes it's not visible, and I have to use my history and other diagnostic approach to make the diagnosis. Because when I treat them, like with antifungals, with vitamin therapy, with the right diet, they get so much better.
I think there's a key thing that you said there, that it's a normal part of our soil. It's a normal part of our gut microbiome. It's not like all of a sudden candida is this bad thing and it comes in and it takes
Right,
over.
right,
It's
right.
part of our diversity. It's part of our
Yes,
gut, right? So it should be
correct.
there. But when we are depleted in minerals, vitamins, stress, cortisol, when things take over, it's an opportunistic and it goes, ooh, I like this. Let me grow here.
Exactly. And one of the things I talk about very early in the book as well was from my podcast, The Smartest Doctor in the Room. I get to interview top doctors around the country and the world. And one of the doctors who was really amazing, and I quote in the book, is Dr. Mark Pimentel. He's the head of Pimentel Labs at UCLA, top gastroenterologist, a leading microbiome researcher. And one of the things that he said stuck with me that I had to write about in the book and put a picture of it. I like pictures. Was that a really healthy microbiome is very diverse. It has all that when you go to societies where the healthiest people are, the microbiome, especially in the gut, is very diverse. And in the areas where people are sicker, it's more homogeneous. And he made the nice analogy. It's like taking a city. A good city has doctors, plumbers, sanitation workers, even lawyers. And a bad city would just have a ton of lawyers. What would you do if your pipe broke? What would you do if you got sick? So I like that analogy, and it's really stuck with me, and I think it's something that's important for people to understand.
Yeah, no, that's absolutely true, and I love the way that he explained that. But let's talk a little bit about allergies and
Sure,
sensitivities or intolerances, because a lot of
sure.
people, it's a bit of a blurred line in regards to that. So, from your perspective, what is the major difference between an allergy, a sensitivity, and intolerance? How does someone know if they truly have an allergy to something?
Question. Um, so there are medical definitions and clinical applications of this. So let's start with what is a true allergy. Okay. A true allergy, let's say food allergy, for example. So a true food allergy is when you eat a food and then typically within minutes, you're starting to get your body having a reaction to it, which is really due to mast cells. That's another area I'm very interested in. And the mast cells release histamine. That's the one we know, and 100 other mediators. And this is what causes people to start itching, to start sneezing, um, to get a rash, to actually have trouble breathing. This is what we'd call an IgE immediate reaction. It's reproducible because if the person ate the food today and then ate the food again a few days later, the same thing would happen. And we're able to, what I like to use is blood testing, which I find very accurate, which can measure the specific IgE, meaning if somebody was allergic to eggs or to shellfish or to peanut, we know exactly from the blood testing how allergic they are. And so between the clinical response and the blood testing that confirms it, that to me proves a true allergy. Now, on the other end of the spectrum are what we call intolerances, which could be due to milk. That's a common one because a lot of people are lactose intolerant. They can't digest the enzyme that's in milk. That's why sometimes they'll drink lactate milk or they'll have to use an alternative milk like oat or almond or soy. That doesn't usually cause a dangerous reaction, but it makes people uncomfortable. It causes bloating and discomfort in the stomach because it's just not being digested, so it's just like sitting there. And I think, Michaela, in the in between is what we call sensitivity. That's a trickier one because if I gave you a true like medical definition of that, that would potentially mean that if I did a blood test and it came back positive, like to egg or wheat, but you told me you could eat egg or wheat, well, then it means you're sensitized somehow, but you're not really clinically allergic. So I hope I try to explain. It's how we look at it medically.
No,
The main
100%.
takeaway really too is, one of the other things I say in the book too is that, patients are all an experiment of one. You and I and each one of your listeners, we're all different. So you have to listen to what they tell you and, hopefully accept that and prove it or disprove it, without disregarding what the patient has to say.
Yeah, 100%. I feel like a lot of people listening and from what I've heard sit in that sensitivity part because they're like, they get. So, with the sensitivity part and the intolerance part, would you get the same reactions with the histamine and the mast cells and the itching and the closed throating
No,
and
no,
things
that's a
like that
good
with
question.
allergy?
With the intolerances, no, most
Okay.
likely. Most
Yep.
of the time it's GI, especially if you're talking about
Yep.
digesting food.
Yep.
Sensitivity, again, it's kind of a big question mark. It's too
Mm.
vague. It's hard to say. I mean, again, it could be mast cell related, um, but it's a little bit of the gray area of this, this whole food reaction
Yeah,
issue.
100%. And the thing is also, let's go into, yes, we're talking about foods, but there's other things that can activate the mast cell and the allergies and sensitivity and intolerance also, like environmental factors. A lot of us are exposed to mold, pesticides, and things like that. Can that cause similar thing as to food?
Yes, it can. So okay, yeah. So the common link there, you brought up something very interesting. Something I may do in my next book. I'm thinking about a lot because I'm seeing a lot of these cases. Is the mast cells.
Yep.
These were cells. Very interesting. When I trained like 35 years ago in my what they call fellowship here in New York in immunology and allergy, I learned about mast cells. But what I learned then was a lot different than I know now. What I learned back then was, oh, these cells, which are in the tissue, they're not in your blood, so you can't see it on a blood test, but they're in the tissues, they're in the lungs, they're in the skin, they're in the stomach area, they're actually in the heart. We were taught, though, back then that these cells were only like involved in allergic reactions. And so somebody ate a food or they breathed in mold, or pollen or animal dander, and they had a reaction. It was because of the mast cells. The IgE would like kind of land like a receptor on the mast cells, bind together, and make the cell release histamine. Nice and clean, made a lot of sense. What didn't make sense to me over the years was I kept on thinking, I'm a little bit of a spiritual person. I didn't put that in my hobbies. But I was like, why would God invent a cell just to torture allergy patients? That seems a little strange, but I didn't know what to make of it. And then something big happened in around the world about 5 years ago. It was called the COVID pandemic. And all of a sudden, I was seeing in my practice patients coming in with like forms of long haul COVID, where they were getting all these food reactions they never had before. They were getting brain fog. They were getting rashes, um, and we started to understand. that the mast cells were in play here. And we now know, I mean, there's this whole new condition called mast cell activation syndrome, which, again, was kind of disregarded as a made up illness and is getting more and more validity because we're understanding that the mast cells are what I call primary immune cells or the patrol cells. They're the first guys to arrive on the scene. If you get a cut on your hand, your mast cells come in to help you heal. When you get an infection, a respiratory, normal infection, your mast cells are the first ones there, and then they call the backup guys to come in and help finish it off. But when these cells are in overdrive constantly, you're going to feel sick. And that's not a good situation. And that's something now I've been seeing a lot of cases that I'm working with and treating patients by getting their mast cells to stabilize. And mold, as you mentioned earlier, is a big one. That's a really bad. I don't know about Australia, but in the United States, I guess with all the climate change and the hurricanes and the floods, I'm seeing more and more cases of that, and those two are really intertwined.
Yeah, and you said, mast cells are found in the skin, lungs, GI, but you also said the heart, which is quite interesting because, as we know, that's kind of like what got affected about 5 years ago on most people, right? The heart got
That's
inflamed.
that's 100% correct. COVID was really throwing doctors off, like especially the children. They were getting a sort of a pericarditis, where you get inflammation around the lining of the heart.
Yeah.
And I think it's also one of the reasons too, because it affects also the mast cells are along the blood vessels and that go to the neck that affect blood pressure, and that's why sometimes that we're seeing these crazy what we call POTS patients, postural orthostatic tachycardia
Yes.
or hypertension, where their blood pressure or heart rate would shoot up and then drop down and back and forth, and made it was very debilitating.
Yeah, 100%. Yeah, you need to get this book out because there's so much information.
It's
Another one.
another project. It's
I
okay,
love
I'm up
it.
for it. I'm a tennis player.
I love it. I love it. So let's go back to the mold part, right? And yes, Australia, a lot of houses have mold, and
Oh,
it's
really?
quite interesting because I saw this actual picture the other day, and it was like three people living under the same house. One person can't stop sneezing, feels nauseous. The other one has like asthma, is itchy, and the other one's totally fine. And all three of them are living in a moldy house, right? And what the person was trying to say is it affects every single person differently. And you
That's
can go
right.
back and you can go back to the soil that you were talking about earlier, right? What soil do those people have? But also maybe potentially genetics, and we can go into that soon too. But yes, mold is a huge issue here in Australia, and the thing is histamine gets a really bad name. It's like histamine is like this bad thing, whereas histamine potentially isn't the issue. Like you said earlier, it just comes in, it just gets released by the mast cells to come and help, right?
Well, right, right.
So
I mean, the histamine plays an important role in our
yeah,
body. So, it's interesting. You bring up a really good point about how it affects different people. I have so many interesting stories, but I'll share one hopefully pretty quickly. One about it was around the COVID pandemic, maybe a little bit toward the tail end. I had a patient come to me, a very strong, you could tell, a guy that had been healthy his whole life. He was actually a truck driver, and he was actually from South America, a lovely man. And he came to me and he said to me, Doctor, um, I've been very sick, and I think it's due to mold. And so I'm listening. And then before he really goes into even more detail, he takes out some pictures that he shows me on his cell phone. That's what people do today. And he shows me pictures. It looked like, Michaela, that somebody had taken a gun and shot him right in the nose. There was pools of blood, like, in a crime scene. I'm looking at this and I'm like, oh my God, this guy's got cancer. This is not mold. And he told me he'd gone to the emergency room like 2 times. They evaluated him. They actually did like an endoscope into his nose. Did not see any cancer, nothing. He goes, Doctor, I think this is mold. I had never seen a case like that. He goes, I've seen mold in my house. And this is what's interesting too, because as I said, he was always very, very healthy. His wife was not so healthy. She had had rheumatoid arthritis for a lot of years, but it was getting worse. He had a son that had a seizure disorder and also asthma, and that was getting worse. And what was really fascinating was he ended up really getting sicker, and it became super obvious because during COVID he was laid off as a driver, and he was home all the time, and that's how it
Yes.
really all manifested. I mean, he was the last domino to fall in the house. So again, going back to what you're saying, yeah, I have patients, I have families, I treat families. Unfortunately, a lot of them do get affected. Sometimes someone gets lucky; they're either a good detoxifier, or genetically they're just in a better position, or better soil that they're not as affected. It's not good for anybody, but some people are definitely more affected than others. Clearly, even within families.
Yeah. And going back to what you said earlier about seeing a doctor is if they just put this into, let's say, ChatGPT or Google, it wouldn't have came up with the same results because they wouldn't have taken a case history. And you
Correct.
taking a case history, you're like, where do you now spend most of your time? What does your wife's health look like? Your son's health? How long time do you spend at work, at home? What cleaning products do you use?
Exactly.
How many times did you renovate your home? Like so many questions that you can go into
Yeah.
detail and then figure it out with them.
Well, the reason I like my job is you have to be a really good medical detective.
Yes.
That's one of the things I learned in all my training, and I was trained by good doctors. And I get a little worried today that everybody's too much of a hurry, too many shortcuts. There's nothing like really sitting down with a patient. Like a lot of doctors, although I try to make it less painful. People usually when they come to see me will fill out like a 2 or 3 page intake. And they spend a lot of time carefully doing it, which I tell them right away. I said, thank you for doing this. This is helpful to me. I said, but right now, I'm going to hear your story directly. I want to hear it out of your mouth. I said, I'll look at all these details after when I'm thinking about your case. But
Yeah.
I wanted you to take me through the sequence of events because, again, one other quick story. It's just so fascinating. I had one other patient that came to me, a lovely woman. She's been living in the United States for like 30 years, but she was British. So she had a really great British accent, the way you have a great Australian accent. And she was referred by her doctor because she was having all this joint pain and swelling in her hands. She couldn't put even her wedding ring on anymore. And so her doctor referred her to me. She'd been worked up and they were trying to rule out, they had ruled out like all these types of arthritis, rheumatoid arthritis, psoriatic arthritis. They said, we don't really see the test that indicated. So my colleague who knew me, he knew I dealt with unusual cases, sent her to me, said maybe Dr. Mitchell can figure this out. So I'm sitting with her, and I must have been listening to her at least 20 minutes, maybe 25 minutes, and I'm thinking to myself, uh-oh, I don't have an answer here. It's not going to happen. But then she said something in the last 5 minutes that changed everything. She goes to me, Dr. Mitchell, in her British accent, she goes, my mom was sick in England, and I had to go back to see her for about 3 weeks. And she goes, Dr. Mitchell, she goes, I don't understand. She goes, all my symptoms went away. My joint pain went away. My face was less swollen. And she showed me pictures comparing her face like now to when she was there. And I could see the difference. And I said, uh-oh. I said, now I'm thinking mold. Something's in your house that's getting to you. And sure enough,
Yeah.
her home was right near the water, was affected by one of the major hurricanes we had had in the past. And they
Yeah.
never was properly remediated. And she had to move out of her house for 6 months. They had to remediate, but it was taken care of, and I treated her. I detoxed her with binders and everything, and she's been fine.
Yeah. And this is where it's important for, people that are listening and it's kind of like reviewing people around you. What's their health like? What symptoms do you have? And do you know what question I love asking is about your pets? Are your pets healthy?
Oh, right,
Has
that's
anyone
another good one.
passed away?
Yes.
Has anyone have any cats, dogs, birds passed away in your house? Because I had a client and their dog passed away, then their cat passed away, then they got a new cat, all in like 3 years. And I was like, oh, what's happening here? Why so many animals young passing away in your home?
They are very sensitive. They're very sensitive systems. They're very sensitive smells. They're like really the classic canary in the coal mine. They can tell you before you get
Yeah.
sick what's going on.
100%, 100%, absolute key. So why do you think, or from your personal experience, or do you even think there has been a rise in allergies around you or around the world?
Well, okay, a couple of things. If we talk about the food allergies, I have my personal opinion, but I think it's being a little bit, supported by the medical literature. I think
Okay.
there's a lot of allergies, which is really disproportionate in the short time frame over the last 20 years.
Yeah.
Previously, I think it's due to microbiome disruption from antibiotics. I think, unfortunately, a lot of young infants are treated with antibiotics. They have ear infections, throat infections, and doctors don't think very much of it. But even a couple of courses can change your microbiome and make you more prone to allergies, especially food allergies. The second thing, also, believe it or not, too, there's so many chemicals, even in infant products, topical things. That's how you get sensitized. And even though they could be natural, I know this sounds crazy. Like, let's say, one of the things I learned early on in allergies that, one of the reasons, Michaela, the reason, like, when you get a cut, we don't have topical penicillin. You know why? Because they found in studies, they used to do this on mice, if you keep on rubbing penicillin on your skin, then you become allergic to it if you take it as a pill. You become sensitized. So I think the same concept goes on with like shampoos and soaps and all these products that, especially infants, they're getting applied to the skin and it's sensitizing them and again creating the allergies. I think those are the two biggest reasons why we've seen disproportionately, this, increased in especially food allergies. Environmental allergies, again, unfortunately the air quality and a lot of those things too are probably have an important effect.
Yeah, so 100%. So it's kind of like external toxins like pesticides, herbicides,
Yes, yes.
what's sprayed in the air, the air quality, and things like that are affecting us. And like you said, it starts from an infant. I know a story where an individual, the kid wasn't feeling well. It was literally maybe ten days old. And the doctor took the baby and put it on antibiotics because its heart rate dropped. And like I understand potentially why that would have been done medically because, you're dealing with a baby. But you put them on antibiotics after 10 days of being on this earth. It's like, wow, where's that soil going? What's happening to the
Exactly,
soil?
exactly. The micro, it's probably so sensitive. It's still trying to form. It's trying to develop.
Yeah.
It's very challenging. Very
Yeah.
challenging.
And I guess that's okay if we're educated then to rebuild that, right? Is it?
Yeah, I mean, I think well, see, that's going to be the holy grail of medicine, I believe, along with a
Okay.
few other important areas of genetics. But I think the holy grail now is trying to find how do we repopulate our microbiome. Again, in the book, which may surprise your listeners or viewers, is that I'm not pro probiotics
Yeah, I was gonna about to ask
because,
you.
again, talking to Dr. Pimentel and this Dr. Satish Rao, leading gastroenterology microbiome researchers, these probiotics don't really do the job. Again, Dr. Pimentel makes the great analogy too, like lactobacillus, which is in many probiotics. He calls it the bully. It might be a good bacteria, but it crowds out the other ones, again, changing the diversity. I
Okay.
think, the only real ways you help your diversity, your microbiome, is by eating really high fiber natural foods, which like fruits, vegetables, things that actually feed the good bacteria in our body. I mean, we all know, we're hearing a lot about it, the processed foods are really essentially destroying the good microbiome. They just, our body is not equipped to handle this processed sugar, you know, gluten, and other kind of products.
Yeah, I think there was a research study I read, and it was saying within 24 hours, your gut microbiome can change if you eat like a high processed meal. I think they were talking
Sure.
about going to like a takeaway shop and that you eat that food, and then within 24 hours, your microbiome is changed um, in a negative way. So, which is quite interesting. So, I'm guessing potentially the same could occur if you do add those vegetables and fruits in there to do the positive side.
Yeah. I mean, look, it's like I tell patients too, like when they have to, first of all, my couple of rules to my patients are, if you think you have an infection, if you think you have an infection, whether it's respiratory or urinary, get a culture. It takes, you can, a doctor or a lot of times now that they have these swabs you can do, you can find out within 48 hours whether you have a true bacterial infection. Because if you do not, you should not take antibiotics.
That's the best
Um,
advice ever, 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 ever.
yeah,
I agree
just honestly,
100%.
in the last year, I'm usually pretty healthy, but I got sick twice. Once was back in the spring. It was kind of a bad upper respiratory, and I was tempted to take antibiotics, but I know the downside of it, and I actually swabbed my nose, and it actually came back something called para-influenza, which is like influenza. It's uncomfortable, but through just some, basic holistic care, I got better, and I didn't take antibiotics. And just recently, 2 weeks ago, again, I had a minor upper respiratory infection, but I wanted to know what it was. Even though it was kind of starting to resolve, and I swabbed myself, and it turned out to be rhinovirus. Again,
Yeah.
both viruses that taking an antibiotic would not have helped, and probably would have been bad for me.
Yeah.
So that's what I'm encouraging your listeners and viewers. If you feel like you may have a urine infection, get a urinalysis or culture. Don't just start antibiotics. Again, your upper respiratory, go to your doctor, get swabbed. I mean, I know a lot of times now people are used to it, for flu and COVID, but they have testing now for like 20 other viruses. So find out what you have.
100%. Can we also talk about a little bit about the potential benefits of having a virus and the whole immune response, what benefit it does for the humans, for us humans, or our
I
immune
never liked
system?
never like to think of virus as beneficial. It's just something part of what it's just something we have to um, live with and cope with, and maybe sometimes it slows us down from our crazy busy lives. Like you start to realize you feel awful and you got to just take it easy. So I'm not aware of any benefits from it, but again, what I do really believe is that if you do a lot of good, reasonable supplementation with vitamin C, B vitamins, vitamin D3, the good stuff that most people should be taking, again, and sometimes even simple things like doing like certain kind of nasal lavages to rinse your sinuses. These are all things that can keep you well. And look, I like to always make the analogy. We were talking about tennis early on in sports. If you're out there in the game of life, let's say if you're out there on the ball field, you're going to get hurt once in a while. It's just part of the game. But what I've always admired about athletes, especially like Novak Djokovic, one of my favorite tennis players, is that they recover amazingly well, and that's all you can ask for. And I think it's the same thing, with medicine and infections. We're all myself. I get annoyed when I get sick, but if I recover within a week, that's a victory. I mean, I know that my immune system is in good shape. I don't, expect anything more or less. And the people that's not happening to, then they have to really rethink and say, am I taking the right supplements? Am I? But again, I would caution you, even with supplements, find somebody knowledgeable. Don't just trust, ChatGPT or something you hear or read in a magazine. There was just an article in the New Yorker magazine. Yeah, a really good writer was writing an article about how ChatGPT and everything's affecting, you know, the flow of information in healthcare. But where so many patients are taking too many things upon themselves. And this doctor who works in the emergency room in New York City talked about how a patient showed up and had a clot in their leg, and it was due to taking excessive supplements that were interacting.
No, that's so bad.
Yeah, so
Yeah,
that
that's
that's
just the start of it, I guess. Imagine what else they're going to be able to see later on with people just taking, high dosage or something, not asking for interactions, taking herbal things, interacting with potentially the medication. Yeah, wow.
well, I talk about it in my book also. I have a chapter on herbs in Candida, and I'm honest about it. I said I'm not a naturopath. I'm not super knowledgeable. We didn't learn a lot about that in medical school, but what I do have is a healthy amount of concern, only because while some of these things may be good, we don't know how they interact with a lot of other things. So you really, there's that concern there. And I always tell patients, honestly, if you do want something like natural, or whatever, like I like ginger, I like turmeric, but I like it as like powders that you sprinkle on your food. So it's more natural. That's how they use spices and herbs in those days, not as a nutraceutical or pharmaceutical, as in a capsule with amount of milligrams, but by sprinkling a little bit on your food to get that natural antibacterial, anti-inflammatory effect.
Yeah, no, 100%, 100%. So while we're talking about food and supplements and nutrients, in regards to the mast cells and the histamine, when you do have that allergic reaction or that sensitivity or the intolerance, are there any types of supplements, foods that are able to assist with reducing that histamine or reducing that mast cell activation, or do you want that activation, or is it too much? Like, what are your thoughts on that?
Yeah, no, you don't want too much. I mean, as they said, if you're feeling symptoms, if you're itching, or you're sneezing, or you're having trouble breathing, or getting rashes, or wheezing, you want to calm that down. Now, there's two phases to that. There are prescription medicines that are very safe. Of course, people know about the antihistamines. I don't think they're as effective as something called mast cell stabilizers, which usually have to be compounded, something like ketotifen. I use
Okay.
that a lot in my practice. There are a couple of supplements like quercetin, a lot of your listeners may have heard of. Again, it's gentle, and I think it's more helpful in addition to a prescribed medication if you're suffering from mast cell activation. But quercetin is very good, as is something called luteolin. Those are both very have been shown in studies to be very effective in stabilizing the mast cells. As far as watching the histamine in your diet, I like to caution patients it's very variable. Because sometimes people can get very extreme. I mean, if you notice that you have problems with high histamine foods like avocado, spinach, eggplant, and some aged cheeses, those are the main ones that you probably want to stay away from. But not necessarily. I mean, everybody, as I said, is an experiment of one.
Yeah, and not for the long term anyway. Your body should be able to manage that.
It
It should be
should,
able to
in
eat
most
it, right?
cases. Yeah.
So going to back to should. So someone has an allergy, let's say to peanut, kiwis, milk or milk proteins, anything like that. So can they ever get out of that, or is that genetically 100%? You have a true allergy. Should never touch it.
Well, great question. Not touching another thing that I specialize in. I just don't see, I don't get to, unfortunately, get to treat enough patients who I think need it. So once you have a particular severe allergy, it typically doesn't just go away, unfortunately. Peanut, tree nuts, shellfish, sesame seed, those things, eggs in some cases, or milk, they can last for decades, forever. What I've been doing in my practice, because this becomes very restrictive for patients. When I say restrictive, meaning their lifestyle. They're afraid to go to restaurants. They're afraid to go on trips. They're afraid to go to parties, especially with the
Mm.
kids. The
And
adults
that
as
affects
well
people
too.
mentally, right? And their
Yes, it's
lifestyle.
really, and you can understand it. I know I would be if I had a dangerous, thank God I don't, a dangerous walnut allergy, for example. I'd be afraid every time I went to a restaurant or a party. How do I know it's not in there? I've seen patients. I had one patient, I'll tell you the story quickly, who had 8 hospitalizations for walnut allergy, and they were all accidental ingestions. She
Oh,
knew she was
mate.
allergic, but it was just mixed into the food somewhere. So what I've been doing for her is using my sublingual drops, where I desensitize the patients. It's a very safe way of doing it. Now, what I tell patients is our goal is not for you to go out, for example, if you're allergic to peanuts and start eating peanut butter and jelly sandwiches. I don't want to disappoint you. But what I am trying to do is that by accidentally, if there's a peanut or two in your salad and your cookie, that you're not going to end up in the hospital. So this to me is a really important thing that I do in my practice. Unfortunately, it's not widely done. There's something else called oral immunotherapy that's done a little bit more. It's a little bit more dangerous. They are a little bit more successful in fully desensitizing patients, but and then those patients can eat those foods, but it's very hard to do in adults and even in children. It's quite difficult. So until we have something better, I do feel like the sublingual drops has been proven and is a good way to bring a certain amount of what we call tolerance so that a child or an adult is protected if they, by accident, eat a food they're allergic to.
So tell us a little bit about this oral therapy, and then we'll go into the drops. What is the oral therapy? How does it
Yeah, the
work?
oral therapy. So I'll give you an example. The oral, let's say, peanut immunotherapy, which I know is available in Australia, I'm pretty sure, and I know it's in the United States, but a lot of practices can do it. They come up, like, let's say, with a powder.
Okay.
And somebody's put it into a capsule or they keep it as a powder and they give it in the office over several hours and they start to desensitize the patient. Then they send the patient home, the child with the parent, to give it every day. And then let's say the next month they increase the amount of milligrams till eventually they go up to sometimes 3, 4, 500 milligrams, which is equivalent to like half a peanut or a full peanut. Eventually they have people eating a peanut every day, but it's a very intensive process, as you can imagine. First of all, you're feeding people these foods that they're allergic to, and so they're getting reactions. That's why they have to be sometimes several hours in a doctor's office, and that's why it only tends to work with children. I mean, adults are not taking. They have to go to work. They're not going to sit there for 3 hours desensitizing, and then the child has to eat that food kind of every day for like the rest of their life.
Mm,
These are
mm,
like a
mm.
lot of things that are kind of annoying.
Yeah.
With the drops, we desensitize them very gently. We do it a much lower dose. So you say, oh, it doesn't work. It's a lower dose. No, the studies show somehow miraculously it does train the immune system to be more tolerant. And, so just by
So
doing a
what's
couple
in those
of,
drops? Is
what's
it the
that?
aller- is it the allergen that's in the drops?
Yes, it is. It's this we call the sublingual allergy immunotherapy drop. So it's a diluted down form of the peanut or whatever. And another beautiful thing, which versus the oral immunotherapy, I'm able to mix and match. So because a lot of the kids that I see, or even the adults, they don't have just one allergy. Sometimes they have four allergies. That's even what makes it,
Yeah.
Michaela, even harder. I mean, all of a sudden you got
Yes.
four or five food allergies you have to be careful of. And so by mixing these in the drops, I'm able to protect them enough so that, they can have a certain amount of protection.
So what you're kind of doing is, and we're going back to tennis, is instead of putting someone into a full game of tennis, you're literally training them. You're throwing the ball at them. You're getting them used to touching the ball. You're getting them to hold the racket, and that's your immune system doing all that with the drops.
Yeah, I never use the tennis analogy. That's a good one. What I usually use as my analogy is weightlifting. I tell them,
Yeah,
to get strong, I'm not starting you out with the 500-pound weight. You'll hurt your back. I'm
a hundred
starting you with the
percent.
1 or 2 pound weights, but every month, we're going to go to 5 pounds, then 10 pounds. And that's essentially how we do. We gently build you up to get you stronger.
Yeah, amazing. And how long does it take? So
Yeah,
someone's
so
going to
the
see
buildup
you.
is usually, it's interesting. The buildup takes, to get to the highest dose, it takes about a year.
Okay.
But remember, the people have the convenience of doing this at home. It's very safe. We mail it out to the patients, so they don't have to come into the office all the time. I think typically after the first 4 or 5 months, I think the patients are getting some protection. We start to see
Yeah.
immunologically. But it's usually to that first year that I feel more confident now that they're in a better position. And then we do this high maintenance dose for another like 2, 3 years, just so hopefully they get lasting protection.
Yeah.
That's what the literature seems to show.
Amazing. And then do you do any follow-up blood tests, like the allergy blood
There
tests?
is some very sophisticated blood test called the basophil activation test that I've been doing in my office. I send it out to a place. Unfortunately, it's quite expensive, but I
Yeah.
do like it better than just challenging kids with foods. It's very traumatic to start feeding kids foods that they've known they're allergic to when the basophil activation test tells us a lot of important information of how their tolerance is building up.
Yeah, that sounds amazing. And you've had success with peanuts, with
Yes,
shellfish,
I've done
sesame.
peanuts, shellfish, I've done the whole range of foods.
Yeah, that's amazing. And you're changing people's lives literally for being having that anxiety as a child or an adult going to a party, going into a plane. Like some people, like we don't even think about it. Some people have like hardcore anxiety just stepping into a
Not
plane.
into sometimes it's airborne. I mean, I had a patient once early in
Yeah,
my years of practice. He was in school, and I don't know why. This was really before there was all this peanut awareness in the United
yeah.
States. So there was some kids playing around in the cafeteria, and they were literally breaking peanuts, and the dust got airborne, and he started.
Oh my
He was a
gosh.
table over. He started wheezing.
Yeah. That's crazy. It's crazy. But yeah, that's amazing that you're able to. So how did you fall onto these sublingual drops? Did you do research? Did you test it yourself? What did you do?
Oh, well, that's another great question. Well, for that one, I have to pull out my original book. I only have 2 books. I did every 20 years a book. This was Dr. Dean Mitchell's Allergy and Asthma Solution, but I talk about in that one. It was kind of interesting. I was classical trained allergist, and I was giving allergy shots in my first like 6, 7 years of my practice. And I had a
Yeah.
patient that had a really bad reaction to the shot, which can happen. It's just not talked about a lot. And there have been deaths from the allergy injections. Again, not talked about a lot. It's kind of scary. So I remember it was a warm spring day in New York, and I had given the patient an allergy injection, and she went to a very bad reaction. Now, fortunately, um, I went with her to the emergency room. I was there when they treated her with epinephrine. I had given her some adrenaline. She pulled through, but I was a young doctor, and I was very shaken. I was like,
Yes.
I had never seen this in my early training because you know what? I didn't see enough patients. The more it's like anything else, the more you see, the more that can happen. So I was really reconsidering my career, and I just sort of serendipitously, coincidentally, came across an article in a journal that I was reading that night that talked about the sublingual drops, about a doctor that was doing them. And I was like shocked. I had never seen or heard anything like this. And I found out about this doctor. It's funny, he was in the Midwest, Dr. Morris, great doctor. And I flew out to Wisconsin to train with him. Turns out he was training with the Europeans. They were way ahead of us in America, like in France and in Germany. And I said, and he had a huge practice. He was treating people from all over the Midwest. They were coming to see him. And I trained with him. And I came back to New York in 1998 and I started doing it mainly for environmental allergies because that was what was shown. I didn't want to touch the foods yet. I wasn't sure we were ready for that. And I did that for like 20, 25 years and had amazing success desensitizing patients that were allergic to pollen, to dust, to mold. One of the nice ones was for animal dander, people that couldn't be near
Yeah.
pets. cats for dogs. I desensitized two veterinarians that became allergic in training, so they could
Wow.
finish their medical training. So that was a lot of fun, and it was just like nice to see. And then I finally said the last like 7 8 years, I said, now I'm ready for the big time. This food allergy thing is really devastating. It's life changing. I think, and then the studies were coming out from a Dr. Kim at North Carolina, showing that this could work. So I said, okay, Dean, now's the time. Somebody's got to do it. Go ahead.
Amazing. I love that. I love that. That's absolutely amazing. And sometimes journals and things just fall into our lap and it's like, wow, this is
Yes, they
literally
do.
meant to
Sometimes
be.
the universe gives you a little tap on the shoulder. You just have to pay attention.
I love it. I love it. So before we close off, so what is the answer to allergies? What's the answer? Dr. Mitchell, what's the answer to allergies? How do we remove them? Do we want to remove them?
Well, there are a lot of interesting things going on. In Israel, they originally showed that introducing peanut and tree nuts early into an infant's life, within the first like 4 or 5 months, can decrease. And I'm hearing now the reports now, after this has gone on now for probably over a decade, that there is starting to be a decline in food allergies. So that's pretty exciting. And I think, again, more we understand about the microbiome and we're careful about antibiotics, and we know how to reverse it even earlier on with hopefully good probiotics or improving the microbiome some way, I think that's going to be the answer to the end of allergies.
Yeah, I love that. I love that. And I'm absolutely excited for your third book. I know you've got two books out already, and I'll put a link to them in the show notes,
Thank you.
which is amazing, amazing work that you've done. And your interest in immunology has just been amazing, and the work that you've put out there. To finish off, what is your health hack? What do you do potentially, maybe every day, every second day, once a year, that really gets you to your optimal health?
Hmm. I think it's kind of hard to say one thing, but I think also most people would agree to be in a very good mental state of mind is very important. So, however you can find that, I love my tennis. I'm a spiritual person. I like to pray. Um, I enjoy my work. I do think, because, one thing we didn't really touch upon, and it can affect allergies too, is stress. Stress, anxiety, depression, we all have to deal with it. We all have to face it. But if we can get the upper hand, I think it keeps your immune system strong. I mean, there are studies that have shown that even in medical students, when they were stressed right before tests, their immune system went down. They were more prone to infections. I know that even happened to me once before I saw that study. I was studying really hard. I was super stressed. And right after the finals were done, I was going on vacation with friends. Wouldn't you know it, 2 days later, I was sick as bad with the worst strep infection I'd had because my immune system was so shot that I got sick so easily. So, try to stay positive and get some exercise.
Yeah, that could literally be a whole episode about stress, sleep, how it
Mm.
affects the immune system. We just literally just touched upon a little bit about allergies and the immune system. So thank you so much for joining us on a
It
Natural
was a
Health
pleasure.
podcast. Yo, thank you for joining us, Natural Health podcast, and remember that you're pure love, living life to your fullest expression. Information provided here is the opinion of Mahela Raguse and is for information purposes only. It does not constitute medical advice. It is not intended to provide medical advice or take the place of medical advice or any current treatment you're undertaking. Consult your own medical professionals for any medical issues that you may be having. This entire disclaimer also applies to any guests or contributors to the Natural Health podcast. It is advised that you consult your doctor or healthcare professional in relation to any health concerns you may be having. Mahela Raguse does not take responsibility for any health consequences which occur from a person listening, viewing, or reading this content. Under no circumstances shall the Natural Health podcast, Mahela Raguse, any guests or contributors to the Natural Health podcast, or any employees, associates, or affiliates of Mahela Raguse be responsible for damages arising from the information provided on the Natural Health podcast. By listening to this podcast, you agree not to use this podcast as medical advice to treat any medical conditions in either yourself or others. Please note, if you're taking prescription, do not stop your medication or start a new protocol, including but not limited to supplements, diet, lifestyle changes without consulting your doctor or healthcare professional. If you or any person has a medical concern, you should consult with your healthcare provider or seek other professional medical advice. Never disregard professional medical advice or delay in seeking it because of something that you have read or heard on the Natural Health podcast or in any linked materials. If you think you may have a medical emergency, call your doctor or emergency services immediately. Neither Mahela Raguse nor the publisher of this content takes responsibility for the possible health consequences of any person or persons reading or listening or following the information in the educational content.